Hello, everyone. Thank you for joining us today. It's noon. We're going to go ahead and get started. Um, we are the Louisiana Provider to Provider Consultation Line. This is the Pediatric Mental Health Tele-Echo. I'm Jody West. Jody Strother. I am the coordinator for the Echo. And today we're going to have this agenda is going to be a little bit different, though. We do not have a case again, so we're going to um, we are very grateful that Paula has agreed to spend the whole hour discussing the topic. So we're going to have it in a different format a little bit today. And Dr. Olivier is going to discuss that when she introduces Paula Davis. But I'll go ahead and get started with ppcl. In case you aren't familiar with us, we provide mental health consultation to providers across the state. You can call us and get support for any resources, counseling, therapy, referral information that you may need for your patients or clients. Pediatric is 0 to 21, and we also provide assistance for perinatal, which is pregnant and up to 1 year postpartum. And this is our QR code. If you need more information about us, you can also go to our website. But I'm going to go ahead and turn the facilitation over to Dr. Olivier, and she'll lead us through introductions for the rest of the ppcl hub team.
Hey everybody, thanks for joining us again. I'm Dr. Olivier. I'm a child and adolescent psychiatrist here in Lafayette, Louisiana. I'm the facilitator for these sessions, so I usually watch the clock and make sure we're running on time. We are going to do things a little bit different, but I'll introduce that in a little bit. But for now, I am the psychiatrist on our hub team. I'm here in private practice in Lafayette, Louisiana. I'll also ask the nurse on our team, she's nurse practitioner actually, Ashley Hutchins, to introduce herself.
Hey everybody, I'm Ashley Hutchins. I'm a psychiatric nurse practitioner and I work at Blue Mental Wellness in Lafayette.
Thanks, Ashley. We also have Lena Reggette on our hub team representing social work.
Yes, hi everybody. My name's Elena. I'm one of the mental health specialists for PPCL and also one of the social workers on the hub team and also helping out with IT. So happy to be here.
Thanks, Lena. And y'all already met Jody. So we have a hub team representing different specialties of pediatric mental health. Is Dr. Queen on the call yet? I didn't see her just
I
yet,
don't see your duck.
but Dr. Queen is our pediatrician on our hub team, so she may be joining us during this session a little bit later. Today, we're going to do a longer didactic presentation since we don't have a case presentation, and we'd like it to be a little bit more interactive. So I know typically we say hold the questions to the end, but today we have Paula Davis presenting, and we're going to ask you to chime in as we go along. Unmute yourselves and just chime in because you can't always see the hands being raised. So just unmute yourself and interrupt. It's okay. Or you can ask questions in the chat and I'll insert those questions in and interject those questions. But I'm going to go ahead and turn it over to Paula Davis for you to introduce yourself and talk to us about adoption narratives.
Sure. So I'm not really sure what to say about myself other than I'm excited to be here. I'm a licensed clinical social worker and I have been practicing in the field of adoption since 1999. I've worked with all members of the adoption triad. So that includes birth parents, and adopted people. Right now, mainly my role is supporting adult adopted people on search. But I am so excited to be with you here today. I am very passionate about adoption. I do want to say that what I say today represents my opinion and is not the views of anybody else. But when Lena asked me to present, we talked about challenging adoption narratives. And I think for me, one of the biggest challenges is how do I keep myself, well, initially to 15 minutes, but now I have a little bit more time. But how do I address what you guys need in such a short period of time? There was an adoption think tank that was in business years ago, and they were looking to reform adoption in the United States. So one of the things that they did is they went across the country and they did a listening tour. And what they found was that the average person scored a C- on a simple adoption and foster care quiz. So that is one of the biggest challenges when it comes to adoption, is that there's a lot of misinformation surrounding adoption. And a lot of times that is reflected in the language that we use. So sometimes that language uncovers biases, but it also shows some misinformation. So we'll kind of start there. And like I said before, if you have any questions or there's something that's burning, please feel free to chime in. Okay, so Jody, if you want to advance the slide. Okay, so the first thing is I just want to know what comes to your mind when you hear the word birth mother. So there should be a QR code, and then I want you to take a minute maybe to put in some things that come to your mind when you hear birth mother. So Jody, if we can give them a minute or two, and then you'll have to hit a key to show their responses. So it should show their responses. And if this doesn't work, I'll have people put it in the chat. Okay.
Yeah, Jody, you'll have to see where it says Mentimeter up top. There you go.
Okay.
So folks can see the QR.
Okay. Okay, so it's not working. Okay, so what I'm going to ask you to do instead is can you put it in the chat? If would you guys be comfortable putting that in the chat? Oh, so it did work for some people, huh? Okay. Okay.
It worked and it took my response, but it's not
Muted.
coming up.
Yeah. It took the response, the QR code worked, but then I can't pull up the
It's not
as
allowing
people.
you. Okay.
No,
It
sorry.
might not be showing the answers because it's on my Menti and not y'all's Menti. Okay. Okay. So I see the mother who gave birth, biological mother. A lot of times when we hear the word birth parent, people will think about what they see, what they see on the Lifetime movie network. It's, this person who is hiding in the bushes waiting to take their child back. And there's a lot of negative stereotypes about women who make adoption plans. And I'll talk more about some of the stereotypes when I talk about myths of adoption. Okay, so can we, all right, so we're on the next slide. What comes to your mind when you hear adoptive parent? Infertility. And I think one of the things that I saw working with families that had adopted is that a lot of times that infertility is not addressed when it comes to adoptive parents. And if that infertility is not addressed, it gets in the way of the parents being able to parent their child. And it is an ambiguous loss, and it's disenfranchised grief. And a lot of times adoption is seen as a solution to infertility, but adoption is not a solution to infertility. Adoption is a solution to parenting. All right, awesome. Okay, yes. Well, and a lot of times people who are in the audience have been touched by adoption. And it's also interesting, as the person who does search and reunion, a lot of times women will search for birth parents younger than men. Men typically don't search until they're older, and usually it is at the urging of their wife or partner, which I always think is kind of interesting. We see that gender issue when it comes to search. But just some myths of adoption that I think are really important to address. I mean, the first one is that love is enough. We know that when you're parenting in adoption, you have to parent differently. I'll talk a little bit more about why you need to parent differently, but it is not as if this child were born to you. There is that loss of the biological connection to the child, and that loss needs to be mourned, even in families who infertility is not an issue. So there were times where I worked with couples who had biological children who later chose to adopt. They still had to mourn that biological connection to the child. Another myth of adoption is the high school girl who got in trouble. So when I was young, back in the early 80s, the high school girl who got in trouble was the typical person who was making an adoption plan. But that high school girl who gets in trouble now is no longer choosing adoption. So why might she not be choosing adoption? If somebody wants to put in the chat or unmute themselves, why might she be choosing parenting instead? Oh, reality TV, definitely. Definitely influenced by reality TV. And there's supportive parents. I think that is the hugest thing. There is not the same stigma related to single parenting as there was back in the day. So women who made adoption plans in like the 60s and 70s, they were sent away to maternity homes, and then they were visiting an aunt in another place, or they were junior year abroad. They made adoption plans, and then they were told to never speak of it again. Sometimes they were given fake names, sometimes they were given fake husbands. That level of shame and guilt no longer exists. So if a young woman finds herself pregnant, she has the support of her family. Also, we have social supports, things like Medicaid and TANF to help support. So there's some resources to help our parents. So we don't have the same stigmas. And in fact, women who make adoption plans now oftentimes do it in the face of a lot of judgment. So they're getting judgment from their families not to make adoption plans. But the woman who's making an adoption plan now is typically older. And by older, I would say 24 to 34 years old. And she's often already parenting other children. And this is the reality. She typically is a very good parent. And I cannot think of a more significant example of a mother putting her child's needs above her own than to make an adoption plan. So it is no longer the high school girl who's getting in trouble who's making an adoption plan. And I think that that is a myth that we definitely need to address. Again, it's not as if this child were born to you. Sometimes I will also hear the myth of the healthy newborn. I would say that even with infant adoption, there is no such thing as a healthy newborn. I'll talk a little bit about that when I talk about the impacts of prenatal stress, but women who are making adoption plans are under a lot of stress. And we know that while they're pregnant, that baby is bathed in cortisol, and that is impacting that baby as it develops. And then lastly, I would say the myth of closed adoption. So in this day and age, there is no such thing as closed adoption. And think about how the world has changed. So what are some things that are different now than maybe, let's say, 10 or 15 years ago? The internet genealogy, yes, huge. Social media. There is no such thing as a closed adoption now. And you will still have agencies and attorneys promising families closed adoptions. It is my opinion that we should prepare parents for the inevitability of openness. Now, the other part of this is that openness is really in the best interest of everybody involved when it is done well. It is in the best interest of the adoptive parents. It helps them feel entitled to parent. To have someone place their baby in your arms and say, I choose you, really helps that parent have that sense of entitlement. It also helps birth parents with grief, but then it helps that adopted person know and have access to information to help with identity formation. So I would say that as the adoption professional, our job is really to help prepare parents and families for the inevitability of openness, whether they want it or not, because that is going to be the reality. And it is not uncommon for me to receive a phone call from someone to say, I found out I fathered a child years ago that I didn't know about that was placed for adoption because of things like 23andMe and Ancestry. So it really is changing the face of the work that we do. All right, Jody, can you go to the next slide? So when we're thinking about the language that we're using to talk about adoption, these are some things that I think that are important to keep in mind. So if a woman is pregnant and is thinking about making an adoption plan, she is an expectant parent. Legally, technically, she is not a birth parent until she signs her surrender. But you may have people who are working with that mom, calling her a birth parent prior to. And I saw a training the other day that talked about they use the word grooming women to become birth parents. And in some ways, that might be considered grooming. But to not even allow a woman the idea of considering parenting. So she is an expectant parent until she signs her surrender. We know birth parent, biological parent is the appropriate term to use now rather than real or natural. I prefer the term adopted person rather than adoptee. A lot of times you'll hear the term adoptee, but a person who is adopted is not solely defined by their adoption status. So I think that that is a good way of representing that. Birth child is another way to talk about that. Make an adoption plan. So a woman who is making an adoption plan is not putting her child up for adoption. And that term, putting a child up for adoption, comes from the orphan train. So, and actually Opelousas was one of the stops in Louisiana for the orphan train, where children were taken from families in orphanages in the north and then sent west, and they would make stops and people would come. Children were placed on blocks and they would choose children based on that. So that's where the term put up for adoption comes from. So make an adoption plan, I think, is a more accurate description. Sometimes people will say, oh, yes, definitely. Older people who were on the orphan trains. And some of them had positive experiences and some of them did not have positive experiences. But making an adoption plan is the preferred term rather than to keep or to give away. And then to parents. And then the other thing is that if you are working with parents who have biological children and adopted children, it's important to use the term biological children and adopted children rather than biological, like referring to biological children as their own children. So sometimes they'll say they have two of their own children and one adopted child. The adopted child is also their own child. They're just not their biological child. Does that difference make sense? But an adopted child is a parent's own child by love and by law. They're just not their biological child. So again, thinking about how the language we use reflects how someone may feel. Okay. All right. Jody, you want to go on to the next slide? All right, I need to move the chat. Okay. So one of the things when we're thinking about adoption that's important to keep in mind is, again, there is no such thing as a healthy newborn and infant adoption. And part of it is because of the impact of prenatal stress. So we know when a mom is thinking about making an adoption plan, she is under tremendous stress. And when she's under stress, that baby is bathed in cortisol throughout the pregnancy, and that has changes on their brain and their biology that has lasting impacts. So that is really important to remember. But if things were going well, she would choose parenting. She would not be looking at adoption. So that's something to keep in mind. And as you look at the numbers that I have here, these numbers are numbers related to Louisiana. They're not specific to adoption, but all of these things show up in some way, shape, or form when we're talking about adoption planning. So for a mom who is thinking about making an adoption plan, a lot of times there is a lack of prenatal care. Part of that is because, number one, she's not planning on getting pregnant. So she's not treating her body as if she was going to get pregnant. So there may be some substance exposure. She's definitely not taking prenatal vitamins. It's not the same level of care maybe that I would have when I was pregnant, or you might have when you were pregnant. So they're not treating their bodies the same way. But they may also not realize they're pregnant till further on in the pregnancy because maybe they're living a chaotic life. Maybe there's a lot of things that are happening that are impacting them, and they may not realize they're pregnant until maybe they're 6 or 7 months along. Sometimes it is because their life is chaotic, and sometimes it's because they're in denial about the fact that they're pregnant. So that lack of prenatal care also has impacts prenatally on that baby as it's developing. There may be some prenatal substance exposure. Again, she's not taking care of herself as if she was getting pregnant. So she may be doing things like she may be drinking, she may be using substances, maybe she's taking prescription medication. All of those things have impacts. Then when you add stress, lack of prenatal care, substance exposure, a lot of times that leads to things like a difficult delivery. It leads to low birth weight. It can lead to preterm birth and NICU experiences. So it is important that when you're working with families that they understand the impacts of all of these things and how these may have long-term implications as they parent. Okay. No, these statistics are not specific to adoption planning. These statistics are actually Louisiana statistics for all births, but all of are present to some extent in adoption planning. Thank you for asking that clarifying question. Okay. All right, Jody, the next slide. Okay. So this is a definition of adoption that I like. So adoption is a lifelong intergenerational process that unites the constellation of birth families, adopted persons, and adoptive families forever. So as you look at that definition, what are some things maybe that stand out to you about that definition? Okay, somebody said it's a little too pretty. Can you tell me more about that? Lifelong and process, definitely. So adoption is not that just that legal event, but it is that lifelong process. Oh, definitely. So when people think about adoption, a lot of times they think about that moment of placement. But as somebody who's worked with adopted people throughout their lives, it is definitely a lifelong journey. I can think several years ago, I received a phone call from a hospice social worker, and it was a woman who was in her 80s and she was dying and she was looking for her birth family. So you think about why somebody who is at the end of their life is looking for information about their history. I mean, it's really that Erickson stage of development, that ego integrity versus ego despair, right? Helping to make sense of her life so that she can die with peace. Personal experience of a closed adoption. So what I would say is that these families are united regardless of whether there is a relationship or not. Yes, united is a tough word. I have patients in the foster system, and this is a tough word. It is a tough word, but regardless, there is still that biological connection that has to be addressed, whether it's a positive connection or a negative connection. And allowing that person to grieve and mourn that loss is super important. So the other thing is that not only are birth parents impacted, but their parents are impacted. I mentioned that many of the women that I work with are parenting other children. Siblings lose siblings. If you think about it, our sibling relationships are the longest relationships most likely that we will have in our lives. So we know our siblings longer than we know our parents, and oftentimes longer than we know our spouses and partners. So that is the longest relationship that we have. And those losses also have to be mourned. One time I was working with a couple and they were looking to adopt. And one of the things that I always try to do when I'm working with adoptive couples is help them have empathy for birth parents, because how they view their child's birth parents will directly impact how they view their child, right? How can a child feel good about themselves if they feel like they came from a bad place? So even when there's difficult things in a child's history, there's also strengths that we need to be aware of. And I will say this, as somebody who's worked with birth parents for almost 30 years, I have never, ever, ever met a mother who did not love her child. Now, with that being said, are there things that sometimes get in the way? 100%. So things like substance use, mental illness, poverty. But it is important to recognize that there are strengths as well as weaknesses, because that will directly impact how a child views themselves. Awesome. Thank you guys so much for your input and your thoughts. Very helpful. Okay, so Jody, can we go to the next slide? So I have this as current adoption practice. And what I should say is that this is current adoption best practice. But not all agencies operate this way, and not all attorneys operate this way. In Louisiana, there is a big difference in how adoptions happen, in the level of education, in the level of support, in the level of evaluation, in the level of training that the staff have across different types of adoption. So that is something to be very aware of. But ideally, adoption practice is child-centered rather than parent-centered. So is the agency or attorney, are they finding children for families, or are they finding families for children? So if they're finding children for families, they're operating under the best interest of the adults, versus are they finding families for children where they're operating under the best interest of the child? So that was definitely something that I saw, especially in international adoption, having hard conversations with parents about what are some of the maybe medical conditions that you feel like you are capable of parenting. What are some of the medical conditions that you feel like you're not capable of parenting? And helping parents think through those things, because they need to go into this with, do they have the resources and supports to parent this child? And sometimes not just until the child is 18, but maybe for the rest of that child's life. So are they operating from a child-centered perspective, an adult-centered perspective? And when money gets into adoption, it gets very muddy. I will say that. Making sure that there is preparation for all that are involved. So are adoptive parents, what kind of education and training and support are they getting? What about birth parents? What kind of support and education are they getting? Are they allowed to talk about openness? Do they understand the benefits of openness? That's true for everybody. Talking about the impact of trauma, and trauma for everyone. The idea of openness and maintaining connections for the best interest of everyone involved. Empowerment in the decisions, including birth fathers as well as birth mothers. Definitely, we see a lot of transracial adoptions. And when you're working with families that have adopted transracially, what does their support system and their social network look like? Are they having tough conversations with their child? How do they parent their child and educate their child for things that they might experience when that has not been the parent's experience? So I think about an adult adopted person who I heard speak one time, and he talked about how, as an adult, or a teenager, when he would go into the grocery store or into the mall, people would follow him in the store, and he would share that with his parents, and his parents would say, "You're being paranoid." Well, they were discounting his experience because that wasn't their experience. So, does the family have supports to help them parent a child transracially? The adoption of children with special needs, and then making sure that there's adoption competent supportive services. We do know that there is an overrepresentation of people who've been touched by adoption in the mental health system. Jody, you want to go to the next slide? And all right, so that's it.